A nurse was fired because of something so innocent and something she did out of kindness. So, this nurse, you know how in some areas, let's say, for example, the bedside nurse is in the room. Let's say Nurse Rebecca is outside and not doing anything. The nurse on bedside, let's say, is on the isolation room and she did not want to get out of the room, but she needs medication. She will ask me to override a medication or get a medication for a patient. And it happened to be a narcotic. And out of kindness and out of being helpful, I will, of course, not say no to that request. Because if I were in her position, I would want someone to do it for me. This nurse was fired because over time they noticed that every time she will get medication, it was not under her patient's name or the patients assigned to her, and they were not scanned. Not all of them were narcotics, and I see this happen all the time. We take medications for other nurse, but that nurse did not do their job in scanning the medication. Now, future USRNs and angels and scrubs, I want you to be very careful with this one. If someone will ask you to pull a medication under their patient's name, especially for narcotics, make sure to ask them, did you scan the medication? Now, if they said yes, I want you to double check the patient's chart and make sure that that medication was, one, scanned, and number two, if you need to waste that medication, that it has to be wasted in the Pyxis machine. Because every time you pull a narcotic, let's say it's morphine sulfate, it comes in 2 milligrams and 4 milligrams concentration. Sometimes we don't have the 2 milligrams and you have to pull the 4 milligrams morphine. If the order is only 2 milligrams, automatically you have to waste the 2 milligrams. Now, that vial has to be wasted properly, not in a regular waste bin, future USRNs. It has to be wasted in a designated container. And it has to be wasted in the Pyxis machine or the AccuDose or the Omnicell. You have to waste it there. Kailangan dalawang RN mag-witness nun. Napatalsik ang nurse na to. Naimbestigahan siya sa Board of Nursing. I don't know what happened to her license, pero nawala yung job niya. It's not for me to judge whether it was a mistake or it was done intentionally, but the reason I'm sharing this with you guys is next time you pull a medication for a patient that's not yours, make sure that, again, they are scanning it.